This is Veggie IQ, a recipe for success. So yay, veggies. How many of you had your salad today? All right, excellent. We hope that you don't go into a food coma because we still have very exciting presenters this afternoon. So let's all pay attention. All right, so much like the 100 Mile Club, our next presenters will share about their program, which could be implemented to meet the goals in your BP 5030. Again, your BP 5030 is your wellness policy, yes. Community programs and partners like Veggie IQ, the Public Health Department, the California Dairy Council, the UCCE program, Kids and Nutrition, can assist with implementation of these programs, provide curriculum, technical assistance, and support, and often staff, key components to successful implementation. We will learn from Katie Kinsella, the project coordinator with Veggie IQ, and Dr. David Kerr, the Director of Research and Innovation at Sansum Diabetes Research Institute. Prior to coming to Santa Barbara, Dr. Kerr practiced in the UK, where he led a very large study looking at using in-school education to reduce the consumption of soda to prevent excess weight gain in children. And we also have featured today on the panel student advocate Lucia Ramirez with San Marcos High School. With that, let's give them all a warm welcome.
Hi, my name is Lucia Ramirez Solano. I'm a senior at San Marcos High School, and this summer I had the opportunity to participate in a program called Veggie IQ, and it really has impacted my life and changed for the better, and our team is going to tell you how. So, welcome.
Thanks very much, and warm welcome after lunch. My name's David Kerr. I'm a UK-trained physician, but I've been in Santa Barbara almost 9 years. And today, I feel as if I've joined a very special club. You're far more fun than the usual medical meetings I go to. So I would like to come again. Is that okay? So I'm going to tell you about Veggie IQ, which is an initiative we're running, have been running in Santa Barbara and Lompoc, and we want to scale this because we think it's the right thing to do and because it works. So it's a collaborative program, and it runs over the whole year because the evidence is that if you want to impact the health of a child or a young person, you can't just do it in the school. There has to be things out of school, after school, in the summer. So our plan for 2023 is to run this across the whole year. It's about linking our choices, our food choices and our physical activity choices, and linking them to our health, both physical and mental. I'm a doctor, and I spent 100 years in the clinic seeing people predominantly with diabetes, but not exclusively with diabetes, but other endocrine problems and other diseases, cardiovascular disease, kidney disease, cancer, a variety of really horrible things. The sad reality is that if we look into our crystal ball and look to the future, what are we going to get from a disease perspective, and what's going to kill us? And what can we do about it? Well, actually, only about 10% of what's going to happen to us is about the healthcare that we receive. Significant portion is how we're wired, our genetics. And you can't do anything about that because you cannot choose your parents. Part of it is due to the exposure in the environment, whether you choose to smoke, whether you choose to take drugs, whether you choose to be inactive, whether the air that you breathe contains pollutants. But the overwhelming risk to our health, and I mean health in a general sense, physical and mental, is about the social determinants, about where we live, who we interact with. Are we lonely? Do we understand how to use the internet? Are we connected to the internet? And so any program that we want to introduce in a school or after school needs to take into consideration these social dynamics, the social gradient where the children and young people live. The sad reality in the United States, about 50% of these dreadful diabolical diseases are related to our food choices. That's a sad reality, and it's a bigger killer than smoking. And I'm not just talking about diabetes or obesity, I'm talking about cardiovascular disease, and I'm talking about cancer. It's about the food choices. Now, no one wakes up in the morning and says, today I'm going to eat crap, and I'm going to be really lazy. I don't know anyone who does that, but circumstances are such that some people don't have a choice. They have to eat badly, or they have to eat poor quality food. We run a program at Sanson Diabetes Research Institute in adults where we provide access to fresh vegetables. We don't teach people about fresh vegetables. We just provide them, seasonally available. They're sourced in Arroyo Grande. And we have had 303 people, predominantly Hispanic, Latino, 35% with food insecurity, low income, and so on and so forth, the social determinants. And I can tell you that if you simply provide access to better food, good things happen. We're about to publish this. Over 3 months, there's less food insecurity, which is great. People lose a bit of weight. Their blood pressure comes down. If they have diabetes, their control improves. If you get them to report the quality of their sleep, their mood, whether they feel pain, they're all statistically, as well as clinically, significant. And scores for depression, anxiety, and stress are better. Access to food, good things happen. And it's really important for children and young people to understand, not just be given information, but to understand that there is a link between food and physical activity choices and what happens to them. So that's what Veggie IQ is all about. I'm going to hand it on to Katie in a minute, but I just want to tell you that what I'm talking about is actually urgent, because we've had a pandemic of COVID, we've got a pandemic of mental health problems. We also, sadly, in our children and young people, we're seeing an explosion in a form of diabetes that used to only occur in older people. Now, you probably know someone with type 2 diabetes. Maybe your parents have got type 2 diabetes. It's a bad enough disease. It's the 7th commonest cause of death, premature death in the United States. But what we're seeing today is we're seeing type 2 diabetes in children and young people. So we're starting to see teenagers having heart attacks. We're seeing 20-year-olds going on dialysis or going blind. And type 2 diabetes in young people is a really very nasty disease. So that's the doom and gloom. The good news is that we can prevent this through programs like Veggie IQ, the 100-Mile Club. And let me tell you, the Department of Education in California, you are too modest. Universal access to better food is game-changing for the healthcare in the United States. And I think you should make more of that, actually. I just hold my hat up to you. This is such a big deal, provided we do it right, and it looks like we will, putting money there. And also, I think we need to make the measurements. We need to persuade people who write the big checks that providing fruits and vegetables in school is not just some kind of Californian fantasy, that it means that as these children, young people get older, they're not going to get diabetes. The girls, when they become mothers, the children are not going to be arriving prematurely because of diabetes during pregnancy. They're not going to get cancers at a young age. So I take my hat off to you, sir. That was the best news I've heard for a very long time. So without further ado, I have the easy part. Now I'll get Katie to explain what it's all about.
Hello, everyone. I'm Katie Kinsella, the Veggie IQ program coordinator. My background's in education. I'm really passionate about social impact, social justice, nutrition, public health, so I feel like I am in the right place, in the right room. And I'm excited to share with you more about Veggie IQ and what it is we do. The World Health Organization stated that improving quality of our health education in schools is the single most cost-effective intervention our nation can do to simultaneously both improve education and health. And I know that's relevant to all of us here. We all know, we've seen the research, how health has such a significant impact on our students in their academic ability and achievement. And so Veggie IQ, we want to do everything possible to provide really high quality, highly interactive, fun, engaging curriculum that excites students and allows them space to follow their curiosities as they're exploring the connections between the food we eat, how we move, the drinks we consume also, and our health, both physical and mental. So the way that we did that, we have two branches to our Veggie IQ program, and I'll start with our high school branch because that's where we started. In 2021, we ran a pilot program for high school students in grades 9 through 12 to gather in person at a local urban farm, and students really got their hands dirty, interacted with this concept of food as medicine, interacted with the agriculture and growing, and they were able to dive into food science and body science. It was all of our curriculum is science-based, evidence-based. And a secondary outcome that we noticed is students were developing leadership skills. They were developing advocacy and activism skills. They were getting community service. Having graduated the program, all of our high school students created a public health campaign that they then shared on their social media platforms to inspire their peers about thinking about food as medicine. And so we'll talk about that ripple effect later. But the impact was so much greater than just the students physically present in our program. So because of the success of our high school program, students were noting they were more conscious of the foods they were eating and the drinks that they were consuming, and we visibly saw the tangible impact. Because of all that success, we were able to, earlier this year, bring Veggie IQ to students at a younger age from 7 select schools, K through 8. And we believe by reaching students younger, the impact can be that much greater before they develop those unhealthy life habits. When you catch them earlier, you can really help them establish those healthy lifestyle habits. So that's our Veggie IQ in a Box program for our young students from K through 8. And that's our module-based approach. So it lives on our Veggie IQ central site, and we train the teachers how to implement this in their classrooms. We launched earlier this year in the spring. We were in over 12 classrooms with 300 students, and currently we're running a program over 16 classrooms with over 330 students. So a lot more students are getting access to this information and developing those healthy lifestyle habits. And what we've learned from Veggie IQ is that our model works. We are seeing the impact, and there's something really magical that happens when you combine science and project-based learning, and also allowing students to, it's a very youth-led movement, so allowing them to determine what they want to study. That's where the magic happens. They're having fun, and they're learning, but they're also teaching along the way, and then they finish the program really just on fire to keep becoming health advocates and champions in their social groups. Oops. Oh, there we go. Okay, so we really believe that Veggie IQ can be the key that unlocks many of these frameworks and the local school wellness policies that we've been speaking about at the California state level, but also the federal level. And Veggie IQ can be a fantastic resource that schools can implement school-wide, district-wide, if you're looking to add to your school wellness policy. And they fall under those 3 categories that I know Catherine mentioned earlier: the nutrition, promotion, and education, physical activity, and the school-based activities that promote student wellness. We have aligned our science-based curriculum and modules so that they fall into these 3 categories. And here at Veggie IQ, we just really take on an inclusive, school-wide approach to student health because healthy students learn better. So what does this actually look like in implementation in some of your classrooms or schools? We have up here our list of modules from Rethink Your Drink, where students are exploring the detrimental effects of sugar in the body and hidden sugars in our drinks, to move it, where they engage in physical activity and look at how that impacts their heart rate and physical health. Eat the Rainbow, really transforming students' ways that they're thinking about the food that they eat in their daily lives. Food in Your Mood, which was really popular with our high school groups, diving into nutrition, the connection between nutrition and mental health, such an important topic right now, especially coming out of the COVID-19 pandemic. Sleep Warriors. No secret that there's a sleep deficit among many of our students and our teens, and so we create champions for better sleep among our students so that they actually are learning why that's so important for their health. And then Pursuit of a Real Happy Meal, where students are exposed to issues of food access and food insecurity in our community, and Health is Wealth, where students are looking at the long-term economic benefits of eating healthy today and how that will impact them in the future. Each of our modules for our K-8 program, for our in-school program, has these key components for consistency and effectiveness. And as mentioned, we have created all of the lesson plans, all of the corresponding materials, the video downloads, so that teachers have that all there. The idea is that teachers implement one module each week, and we now have 7 modules, and that's flexible to best meet the needs of students. We have a menu of hands-on, highly interactive activity options so that teachers can pull from, grade level appropriate from kindergarten through 8th grade. And then our home connection. I know previous speakers were alluding to that, how important it is to get that family engagement. And so what we've found is that our Veggie IQ youth scientists are bringing this information home and sharing it with mom and dad and siblings, and the whole family is changing the way that they're eating, cooking more at home versus eating out. The students are actually going grocery shopping with their parents and talking about some of the lessons they learned in Veggie IQ and how that translates to what they're eating. So they say a picture is worth 1,000 words. We have lots of pictures for you. I'm going to play this short 2-minute video to give you a better taste of Veggie IQ in action.
Today in America, only a minority of families eat the recommended number of vegetables and fruits each day. This is important, as up to half of the burden of chronic disease is due directly to poor food choices. This is not anyone's fault. None of us wake up in the morning deciding to eat bad food and be lazy. The diseases we are talking about are deadly serious, including heart disease, strokes, obesity, type 2 diabetes, and even some cancers. We also know that food and physical activity choices can directly impact our mental health, affecting our risks of anxiety and depression. These diseases also directly impact our society, leading to a crippling financial burden on families and health systems. For many, healthcare is already unaffordable in America. It doesn't have to be like this. At Veggie IQ, we believe teaching children and young people about the links between their food, physical activity choices, and their health is the way forward for a healthy future. The idea behind Veggie IQ is very simple. Good physical and mental health depends on children making good choices. Veggie IQ is based on science. And to prove Veggie IQ works, we measure important outcomes like physical activity, mood, sleep quality, and food choices such as soda consumption. Veggie IQ is a project-based, highly interactive curriculum that allows students to explore how to make better food choices, why physical activity matters, the importance of sleep for health, including mental health, the economics of food and health, and also knowledge about food and society, access, trust, and food security. Knowledge is power, and physical and mental health knowledge is the most powerful of all. Children are our future, and we all want them to be healthy. Veggie IQ holds the potential to make a huge positive impact on us all. Veggie IQ, science, a recipe for health.
So that's Veggie IQ, 2 components, in school, K through 8, module-based curriculum. We have created materials. We need help to implement this and make sure that the children can access it. After school, summer program for the older children, where we have, again, modules focusing on food choices, physical activity choices, but we're not just giving them information. So this is not a traditional after-school class. It's about curiosity. And it's also about teaching older children, and you can do this in younger children, about critical thinking, so that when big food comes along and says they've made this caffeinated energy drink that's going to improve your performance at an examination, we all know in this room that's nonsense. But children face the power of advertising to sell products which have zero health value. And so it's really important that we teach children, and there's data to show that it's entirely possible to critically think about statements related to their health and to make them curious about their health and what they can do about it to reduce the risk of these diabolical diseases. Now, it's all very well me standing here saying, this is the best thing you'll ever use. I'm a physician, researcher, and I know that you need data. Because if you're going to use it, I need to prove to you that it works. Critical thinking. So, for the Veggie IQ program over the summer, we measure things. We give the participants Fitbits. So we look at changes in their heart rate over time. We ask them to record their consumption of demon drinks, such as Coca-Cola. We ask them to record their consumption of water. We ask them to record their sleep. There is a U-shaped relationship, by the way, between how long you sleep and your risk of diabetes. So there's a window where there's a high risk if you undersleep, and there's a high risk if you oversleep, and at the bottom of the U, there's a magic portion where you can reduce your risk of getting diabetes. So on this slide here, you can see the data. In all of the measures, by participating in Veggie IQ over the summer, there were health benefits, physical and psychological health benefits. But there's more to Veggie IQ than just the benefit for the participant. There's the ripple effect, where we're starting to see if you teach children and young people to critically evaluate health and what they can do about it, we know that it impacts the families. And so my dream, actually, particularly for the local underserved Hispanic Latino population, because of the family structure, if you give the child or the young person data, that goes to the parents, the grandparents, the cousins, the uncles, the aunts, and they start to have these aha moments and start to see the link between our food choices, our physical activity choices, and the mental and physical health of the children, and therefore, for them, it is impactful. So, the best advert in the world is to have someone who's actually been in Veggie IQ. So, would you like to come up and just say a few words, Lucia?
So, hi, my name's Lucia. So over the summer, I did Veggie IQ. Sorry. And going into it, I didn't really know much. I just knew we were going to meet once a week. My sister and I both did it. She was doing it for the community service. We didn't really know much, but we truly are grateful that we did end up doing Veggie IQ. Before entering, we both were very physically healthy. My sister and I both do cheer at school. We both dance, and my sister plays soccer, so we're very athletic. But we never really understood how we should treat our body in return. We never ate the right food. We always just relied on our sport and said, no, we're still healthy. But I think Veggie IQ has really taught both of us that what we do to our body really will affect our own self, like even sleeping. I didn't even know sleeping was going to even help me that much. Going into, I only like slept 6 hours. Now I sleep like 9 hours, which is like crazy to me. So I feel so much better. And even my education has improved. Going into Veggie IQ, I participated in a health careers academy at my school. So I'm very interested in health. And because of Veggie IQ, now I'm doing the CNA program at Santa Barbara City College. So pretty much it's a program to get certified as a nursing assistant. And Veggie IQ, really, everything that I'm learning at CNA, I already learned that Veggie IQ, so I feel like I'm ahead of the game, and then like everything's just connecting. Like it's just relating back to the real world. So I'm like, yes, I need to know this. This is helping me, and I'm happy that I did it. And my sister, she was a freshman going into it, and now she's in the health academy at my school. So it really impacted her as well. But the whole program was really fun. We would make food, like colorful rainbow food. And my sister, she's 10, and she would see us and she's like, why am I not in the program? I want to join. Like, can I please go next time? But then I was like, no, there's only like 16-year-old there. Like, no. But my sister really wanted to do it. So I think that's good that we are trying to put this in schools and elementary. So I'm very grateful for it. At CNA, we work with elders, and I do see a lot of diabetes like within elders. So I think it's good that we want that not to happen to younger students and athletes. So it's not nice, obviously, but it's interesting to see how it's already affecting like the elders and how it could affect the teens these days. So yes, and a little fun story. I told my friends that I was gonna miss school today because I was gonna have this meeting, and they're like, "Why are you missing school?" And I told them about Veggie IQ, and my friend was like, "Why was I not invited to this?" I was like, "I'm sorry," but I showed them the pictures of the foods that we made, and my friend Will was like, "We're gonna need to make that tomorrow after school. I'm picking you up, and we're gonna go make this at my house." I'm like, "Okay, let's do it." So the ripple effect is truly happening. I've been talking to my family. I love going shopping. My mom hates it, but I love it. I love going to Trader Joe's and buying all the most colorful foods and making it with my family. I love making smoothies with my mom. I love making oatmeal cookies with my parents. I don't know, it's just a blast. And I think even just like the little things has improved my own health. I'm not saying that I'm never gonna stop drinking Coke, because I will sometimes be drinking Coke, but I just like even small things like adding like oatmeal in your smoothies, adding instead of like, I don't know, just like, changing small things even and teaching them young, I think is key to the community, because the kids will learn from the beginning of their school careers. Like I remember everything that I learned in kindergarten, so I think if we start them young, it will also help them remember. So I think this is a great program, and I mean, I did this program for 8 weeks, and I can't imagine how it will affect younger students if they do it the whole school year. So I think it's crazy to think that we can do this, so I'm very grateful for it, and I'm happy I ended up doing Veggie IQ this summer with my mom. My sister. Thank you.
Thank you so much, Lucia. She is just a perfect example of the kind of impact Veggie IQ can make. And for me, on a personal note, I think my favorite part, the most beautiful part about being part of Veggie IQ is seeing that transformation, seeing the increase in confidence in students. They go from having been on the receiving end of receiving support or tutoring or help, and then they become the teachers and the mentors and the leaders. They're becoming trailblazers, really just agents of change in their friend group, in their families, and then that just expands bigger and bigger. So that it just gives me goosebumps thinking about the kind of change that we can make. If Veggie IQ made such an impact on one student and her whole family, think about if this was district-wide, just the potential for healthier schools, healthier. And all of these organizations have added just tremendous value to the programs and the offerings that we're able to offer our youth scientists and our students. So we have them up there. And then I'm going to hand it back to David for final remarks and next steps.
So I hope I persuaded you that it's really important to link our choices, food, physical activity, to our physical and mental health. It's really important that we tackle the burden or the disproportionate burden of chronic disease through multiple measures. So just teaching someone to run and eat bad, while they still eat bad food and sleep poorly, is not going to be successful. You have to tackle this on multiple levels. We've proven to you, I hope, that if you look at the data, VeggieIQ works. It worked in Santa Barbara twice. It worked in Lompoc this year. But I'd like it to work in Lompoc next year. I want it to work in Guadalupe. I want it to work in Santa Maria. I want it to work in Carpinteria. I want it to work in Los Angeles. And I want it to work across California, because what I've heard today, applying science to prove the value of the universal access to food makes so much sense to me. So there is a QR code for you to sign up. It's free. I can't see there's no downside to eating more vegetables. You might get a bit of wind, but that's about all I can think of. So with that in mind, I'd like to thank you for your attention. I think we have time for some questions, so feel free to ask. And thank you very much indeed.
Okay, well, thank you, Dr. Kerr. Thank you, Katie. Thank you, Lucia, for your presentation. Very inspiring. You all have to have some questions. So I think we have the mic. Marina's out there. Raise your hands. All right, Chef B, get it started.
Hi. Do you know if this program could be funded by ELAP funds or potentially the education part of the KIT funds?
I'm going to say yes, not knowing anything about it. I think it should be. I was just listening to, I've never heard of ELOT before, and then I was looking at universal access, and we want to work with schools. So presume the mechanism for the dollars to flow would be from state to district to school to us in collaboration, because programs such as VeggieIQ, for them to work, we need your buy-in, but we can help you prove that what you're doing works. And so in terms of sustainability of any intervention, I'm thinking about combining 100 Mile Club with VeggieIQ. What a combination. That would be amazing. And we can go to Google and ask them to cough up a few thousand Fitbits so we can add that to it. I just think there's a lot of potential here. So that's a long-winded way of saying I hope so.
Other questions?
Yes. I've tried the QR code 3 times and it brings me to I don't need it. It brings me to a sweepstakes. You win! You won! You won! One program for my district. I guess I don't understand. Hi, I'm from homeschool district, which you didn't mention in your litany of districts, but I know you want to be homeschool district. What I don't understand is like what it looks like on the ground in a school district.
Yes, so for K through 8, we have all the lesson plans and materials for teachers on a website called VeggieIQ Central. And so we do an info session, meet with the teachers, the principals, and share all of that information with you. And there's 7 modules to be implemented. We recommend once a week, and the modules are about 45 minutes each. And in each module has an intro and context building and hands-on activity, and it's connected to those themes that we shared, like rethink your drink, for example. And then the teachers choose when in their day to implement it. And we actually, earlier this year, had a few teachers, because of the holidays and they were trying to finish before summer, who did 2 modules each week, like on Monday and Thursday for 3 weeks. So there's flexibility, and we want it to be flexible so that it's best meeting the needs of your student body.
And the modules are like vary based on grade level?
Yes,
Okay.
yes, we have K through 8, yeah.
So teachers could contact you, the district, like how does it generally work? Is it a teacher to Veggie IQ?
Typically, we've met with principals and administrators to share the information, and then they select, or the teachers sign up, and then we have shared that. The teachers can log into Veggie IQ Central. But we do believe that Veggie IQ could be extremely beneficial district-wide also, so hopefully we're open to that too.
The other thing to say is that the modules are living in that, I mean, I'm not a teacher, I'm a mere doctor. And doctors are notorious for being the worst teachers, by the way, okay? Through my professional life, I always hired teachers to do the diabetes education because doctors are terrible at it. But the modules are living. So if you try a module and you go, yeah, that was good, but it could be better, I have this amazing idea, we are very receptive to that. Very receptive indeed. I'm sorry about the QR code. Maybe our IT...
They said if I just scroll down.
Yeah, just scroll down and hit skip advertisement.
Yeah.
All right, so if you skip the advertisement, I don't know, I mean, it's not for a contribution or anything, but they're always welcome. I'm not quite sure what happened there.
Any other questions?
This one over there? I would love to be in that situation. Basically, we're offering this, and we want to discuss with the people who sign the checks about the best way of sustaining this. So I don't know the answer to that at the moment. I think it will be whatever works so that the maximum number of children and young people can access the program is the best way forward. But I don't know what that's going to look like. Yes.
Building on what she's talking about, my mind is going to licensing and training the trainer. So the state of California funding curriculum as part of general curriculum across the state. Permanent funding for school districts so that nutrition education is a permanent component of curriculum. That makes sense to me.
I 100% agree with that. I'll sign up today for that. It's not just it's nutrition and physical activity, so...
Both.
Both.
Because physical activity is the other component that's constantly
Yeah.
cut from state budgets. So physical activity and nutrition education as permanent requirements of curriculum, just like math or science, et cetera.
And do you know why it should be attractive to the state? Because if Veggie IQ stops one person getting type 2 diabetes, the cost savings are enormous. Enormous. Because you're stopping a person getting a chronic disease which has uncertain but potentially life-threatening outcomes. You're reducing the need for expensive pharmaceuticals. You're reducing the problem of taking time off work to have to go to all these clinics to have your eyes screened and your diabetes care. So the health economics, if I was sitting at state level, the health economics of this are pretty clear, I would have thought. So,
And from a human-centered perspective, those of us who've lost people to diet-related illnesses would stop children from losing their parents permanently, siblings from losing each other. So I see it from both sides.
and also, if you care about preventing the catastrophe of disease that was associated with the COVID-19 pandemic, you need to take a hard look. Who did worst in the COVID pandemic? Poor people, underserved people, people with chronic disease, diabetes in particular, obesity in particular, high blood pressure in particular. They're diet-related diseases. And so even from a pandemic planning, it makes sense to improve the health of children and young people through initiatives such as the 100-Mile Club Veggie IQ.
Any final questions? Looks like there's one more, yes.
I was just going to say, well, you know, if I was an insurance company / medical provider and I was saving, you know, millions of dollars by giving this thing, I think that you guys, as, you know, should present to your board that you should pay for it and provide it to the schools for free, since we're going to be saving you so much money. Yeah, right.
Oh, wait. That's for another day. Big Pharma run the world, okay? So, but I take your points well taken. But I think this could begin at the state level. So if there's any from the state of California here.
Thanks for being a good sport.
All right, okay.
We'll take one more.
I was just wondering if you guys were thinking about putting together high school modules. We in physical education do nutrition once a week, and if all the teachers are creating their own curriculum from outdated health books, and it would be nice if we were all on the same page and teaching from one program. So are you thinking about that, or can we use the 8th grade model?
No, we are thinking about it. I mean, so the Veggie IQ is evolving, and we love to do that because what we're hearing about learning about not just food, physical activity, food, mental health, but also social justice, health inequities, you know, racism, the effects of the social determinants. All of that starts to come through in the young people. They're asking these questions. Does it really have to be like this? And so we'd love to work with you to set up modules. I mean, we don't have all the answers. Someone said this earlier. They don't have all the answers. We certainly don't have all the answers. But to work with the children and young people, the teachers, the schools, the administrators, to create something like this seems really attractive to me. Do you want to have the last word?
Veggie IQ is amazing and awesome. You guys should do it.
Well, this is great, and it's been a great conversation. Please do reach out to learn more about the program and how you can enhance existing wellness initiatives back at your district. I want to point out that any SOUPs, assistant superintendents, board members in the space here today? Excellent. So this is an opportunity certainly to take this back to your principals and to other leadership to see about ways to incorporate some of the things that you're hearing today. This is an opportunity also to think about revamping maybe some job descriptions, hiring wellness coordinators if you don't yet already. So finding creative ways to implement various programs that you're learning. So with that, let's give them one more round of applause.